Hello, my topic is treatment of progressive multifocal leukoencephalopathy with pembrolizumab. My name is Oscar Yupa Buñay, Medical English, Dr. John Moscos. Definition: progressive multifocal leukoencephalopathy is an opportunist brain infection that is caused by the JC virus and is atypical, fatal, unless immune function can be restored. Programmed cell death protein 1 is a negative regulator of the immune response that may contribute to impaired viral clearance.
Welcome to USMLEFasttrack.com. The section we're going to talk about today is from First Aid for the USMLE Step 1, 2013 edition. Acute disseminated post-infectious encephalomyelitis, metachromatic leukodystrophy, Charcot-Marie Tooth disease, and Graves' disease. What is progressive multifocal leukoencephalopathy? PML is when there is demyelination of the CNS due to destruction of oligodendrocytes. What is PML associated with? PML is associated with JC virus or the John Cunningham virus, which is a type of human polyomavirus. What group of patient is PML most commonly seen with? PML most commonly is seen in 2 to 4% of AIDS patients in which they have reactivation of the latent viral infection. Describe the disease course of progressive multifocal leukoencephalopathy. PML is rapidly progressive and is usually fatal. For more information on this topic, click on the link in the description section below. For a full USMLE Step 1 review, be sure to check us out at USMLE.
Application in medicine. Pembrolizumab treatment was associated with a decrease in detection of the PD-1 on lymphocytes in peripheral blood and CSF. Complete suppression of PD-1 expression was not achieved in the CSF lymphocytes of any patient, despite a 33 to 7% decrease in PD-1 detection on CD4 positive cells and a 38 to 90% decrease in PD-1 detection on CD8 positive cells after the first dose. CCS cells recovered PD-1 expression earlier than blood cells, 4 to 6 weeks versus 4 to 6 months.
My name is Aaron Sarver. I got a brain virus about 9 months ago, and because I was on maintenance chemo for so long, it actually lowered my immune system, and that's how I got this brain virus. Couldn't even really read anymore. It was weird. It was like, and I was a English major in college, and I was like, what? This is terrible. I can't really feel my right side, but I'm actually starting to, because of this place, I'm actually able to tell that I have an arm and a leg and everything that's actually normal, and little things like just um, I'm my muscles and everything are actually getting better, stronger. What Dr. Randall trying to do is actually fix my brain first, and my body will actually follow, if that makes sense. Because if I can get everything right in my brain, then everything else will just fall into place. The greatest thing about this place is that it's just going to definitely help me get back to normal, my normal life, because I, for a while there, I just want to thank everybody here for doing what they've done so far. And it's going to get better, I can't wait to talk to you in like, maybe 3 or 4 months when I get back.
Present cause. Pros. After treatment with pembrolizumab, 5 of the 8 patients had clinical improvement or stabilization, and MRI showed corresponding stabilization or reduction in lesion burden. None of the patients had complete disappearance of PML lesions. Cons. Treatment with pembrolizumab had no evidence effect on the hematology or immune disorders underlying PML, and amelioration of the primary disorder was not likely to have explained the decrease in JC viral load.
Hi guys, my name is Daniel Andonsen and I was diagnosed with BML in 2015. Here is a little info about BML. BML is usually a fatal disease. It left me without speech, as you can hear. And also I have some coordination issues on the left side, which makes walking and balance very hard. I am making this video to raise awareness for BML because there is much info on it, and also for my 2 boys. The videos that I will upload will contain my fight against BML.
Pseudoplate in Ecuador. Pembrolizumab provides more benefits than chemotherapy for 2/3 of patients with the most common type of lung cancer. Pembrolizumab is currently the only immunotherapy approved as the first line of treatment for lung cancer, both independently and in a combination with chemotherapy.
The role of the immune system is to protect the body from foreign invaders. Normally, the immune system responds to tumor cells as it does to any foreign invader, by destroying them. T cells play a central role in this immune response to cancer. T cells are primed and activated by dendritic cells within the lymph nodes. They can then infiltrate the tumor microenvironment, which is comprised of tumor cells and other tumor-infiltrating immune cells. Here, the activated T cells detect, bind to, and kill tumor cells. Programmed death ligand 1, or PDL1, is one of the inhibitory ligands that, under normal conditions, help maintain immune homeostasis. However, in many cancers, PDL1 can help tumor cells evade the immune system, particularly when it is expressed in abundance. This occurs when activated T cells release interferon gamma, leading to overexpression of PDL1 on both tumor-infiltrating immune cells and tumor cells. PDL1 interferes with the body's anti-cancer immune response by binding to its receptors B7-1 and PD-1 on the surface of activated T cells, thereby deactivating the T cell's cytotoxic activity. T cells can also become deactivated when PDL1 expressed on tumor-infiltrating immune cells binds to B7-1 or PD-1.
Conclusion. The findings are consistent with the hypothesis that in some patients with early pembrolizumab reduced JC viral loads decrease CD4 positive and CD8 positive activity against JC virus. Clinical improvement or stabilization occurs in 5 of the 8 patients who received pembrolizumab.
You need to be a neurologist in order to diagnose it. It's a disease that is at the intersection of infectious disease and neurology. So you have neuro-HIV specialists or neuro-infectious disease specialists, such as I am, who are taking care of those patients. Otherwise, these are just MS neurologists or infectious disease specialists. Hopefully now most general neurologists are aware of this rare disease of the brain, which occurs as a complication of a good treatment for multiple sclerosis. But it is true that PML is a difficult diagnosis. And actually, we recently published a paper about delay to diagnosis in PML, both in HIV-infected patients, where it's a classic opportunistic infection of the brain that's been described since the 80s, at the beginning of the HIV epidemic, and in HIV-negative patients, such as MS patient treated with natalizumab. It's a complication that occurs since 2005, and the average delay to diagnosis of PML was 77 days. So it took more than 2 months, for people in average to get their proper PML diagnosis. Covers, on the other hand, there's now an influx of lymphocyte into the brain in the case of natalizumab-treated MS patient, leading to a massive inflammation at the site of JC virus infection, which is called an immune reconstitution inflammatory syndrome, or IRIS. And IRIS is also a serious complication of interruption of treatment with natalizumab, which may need to be treated with high dose of corticosteroids, right? So it's not only that this medication can lead to PML in the first place, is that the aftermath of stopping the medication may lead to a very inflammatory reaction inside the PML lesion that can be deadly in and of itself.